like Hashimoto's, your immune system's out of whack and it keeps on attacking certain proteins in your body. So it might interact with your thyroid, it might interact with your gut, maybe you get colitis, maybe it interact with your joints, you get rheumatoid arthritis. If you just have Hashimoto's, don't think, oh, it's just going to be with my thyroid. It could really be a problem later on. Or let's say you have rheumatoid arthritis, it could lead to potentially Hashimoto's.
Hi, everyone. Welcome back. I'm Theresa. I'm a mom, I'm a health nut, and a wife to a cancer fighter. And today I'm talking with Dr. Jake of Integrative Medica about Hashimoto's. This is a very common autoimmune issue, and we're going to talk all about it. What are the symptoms, how to treat it, life after Hashimoto's, all of it. Dr. Jake, thank you so much for being with me today.
So this is going to be a really fun topic because I love talking about Hashimoto's because a lot of people just aren't getting treated for Hashimoto's appropriately, or many times they're not even getting diagnosed with Hashimoto's by their conventional doctor. So it's going to be really fun to be able to talk about that and kind of get people knowing about this condition.
Yeah. And so you see a lot of people with Hashimoto's, yes?
I've probably seen hundreds, if not thousands of patients with Hashimoto's. 80% of people that have hypothyroidism have Hashimoto's disease, but many times they just aren't diagnosed with it because their conventional doc doesn't really care to know about it because their treatments aren't going to be any different.
Now, their treatments are not going to be any different from a traditional aspect, but with integrative medicine, which is what you specify, and you do treat them differently, yes?
Completely
so
different.
Tell me about a story where you've had a patient come in and you've diagnosed with Hashimoto's and what happened with them.
Yeah, so I had Martha come into my office. She was dealing with a ton of fatigue for a really long time. She wasn't really able to get out of bed very well. She got to the point that her husband was like, hey, we got to do something because you're not able to take care of our kids. You're not able to work. You're not able to do anything right now. So we need to get you back to being my wife. So we found a place. So they really searched around. They found me. And we dived into their case. And when I started listening to their history, one of the aspects of their health issues was that I thought they'd probably have a thyroid issue. There was all kinds of other things that I was going to look in, but I saw that as a piece. And when I was looking at that piece of the puzzle, I found that she did have hypothyroidism and Hashimoto's thyroiditis. So when we started approaching that, we gave her some thyroid hormone based on what we saw on her labs. We gave her a combination of T4, T3, and also we started treating the Hashimoto's thyroiditis. We started treating her gut, identified what food sensitivities she had. We identified that she had these chronic infections that we needed to take care of that were related to her Hashimoto's thyroiditis condition. We identified that we need to heal up her leaky gut syndrome and a lot of other things we looked at to help deal with the Hashimoto's thyroiditis. And over 3 to 4 months, her symptoms started to get a lot better. She was able to function. She was able to get out of bed. She was able to take care of her kids. She homeschooled. She was able to start homeschooling her kids again. And she was able to live her active lifestyle again. So it was really awesome to be able to help her start living her life again.
You know, I imagine based on what you're saying that a lot of people with undiagnosed Hashimoto's might be under the impression that they're suffering from something completely different. Like, oh, I must be suffering from depression or something, when really, you know, they're thinking it's up here, right? When really it's something that's not necessarily going on in their mind. It's a biological thing that's happening in their body that's totally treatable.
Mm-hmm, for sure. So one of the symptoms of hypothyroidism is depression. Yeah.
It's definitely related. Well, I'm excited to dive into this and to learn more about, you know, what are the specific symptoms, what kind of labs we can have done, and how you know, other ways that we can treat it. But first, we do want to remind our audience that this is just a podcast, right, Dr. Jake?
So yeah, I'm not going to make any specific diagnoses for you. I'm just going to be talking in general senses, right? So I'm going to be talking about Hashimoto's, how I approach Hashimoto's generally. But really, to really treat you effectively, you need to go to an integrative doctor. So if you really are interested in that, you can visit integrativemedica.com, find our phone number, and set up a visit with me or someone on my staff that can really give you good help.
Thanks so much, Dr. Jake. All right. Before we dive in, I want to know, you mentioned earlier that your daughter got hurt. I know she's into dance. What happened with your daughter?
So yeah, my daughter's really into dance. She loves to do ballet and she loves contemporary even more. So she was trying to do a triple pirouette, I think it's called. It's like spinning on one foot 3 times. When she got to the third rotation, she kind of just collapsed and she sprained her ankle and swelled up and she couldn't really perform anymore during her practice then. And then she gives me a call and I hear her say she's crying, and she's like,
Aw.
I'm like, oh, what's going on, girl? And she's like, I'll tell you when I get there. And showed up, and she was just crying because her leg was all swollen. She's never hurt herself in her life, which is interesting because she's always like wanted to be hurt. She like plays like she's hurt all the time. So this was the first time that she actually got hurt. She used to always play with her crutches and stuff, always act like she's hurt and wrap her leg up. But this time she actually did get hurt, and we had to give her some crutches and wrap up her leg and do all the things that she was really excited to do. She did find out that she really doesn't like to be hurt. So I think it was good for her to actually experience a sprain in her ankle. So it's 1 week in now, and her ankle's doing a lot better, and I think she's actually going to go to her dance practice now. Even though it hurts a little bit, she can't do everything she wanted to, but she's in a place that she can actually not be in a ton of pain. So that's what
good to
recently
know.
happened.
Now, question for you as a doctor. Do you take her to another doctor to diagnose a sprain, or do you like run your own tests to be
Yeah,
able to diagnose your kids' issues?
yeah, I don't think my kids have ever been to another doctor besides me. So I do all my own stuff. If I need imaging, I'll order all my own imaging. Now there are places that I need help, but I haven't really needed that help with my kids. So yes, the majority of the cases, I'm the one treating my
I love
wife.
that. I think that is just so special. All right. Well, I know our audience is super eager to learn more about Hashimoto's. It's a common problem that we're seeing. Some people might be wondering, do I have it? I've heard of this term. I've heard of this. I've been doing some Googling. I want to learn more. So let's start off. Let's talk about if someone has Hashimoto's, what are some possible symptoms they might be struggling with?
So Hashimoto's, like I said, is 80% of people with hypothyroidism have Hashimoto's. So usually what you're going to present with is the hypothyroid-like symptoms. So you're going to have fatigue, you're going to have brain fog, you're going to have constipation, you're going to start losing your weight, you could start gaining weight, you start getting dry skin, you might start getting maybe a little bit of a depression, you might start getting some joint pains, you might have sleep issues. So these are some things that could go along with Hashimoto's, but you might have other autoimmune conditions going on too. Let's say Addison's disease, or maybe rheumatoid arthritis, or other things that just Hashimoto's hasn't been identified yet.
Here's a question that I think is really important. Hashimoto's is attacking the thyroid.
Mhm.
And we have all these possible symptoms that someone might be having. What's the thyroid supposed to do? Like, what's it in charge of?
The thyroid, main thing it does is it's in charge of our metabolism. And when we think of metabolism, we think, oh, weight loss. Oh, someone that has a fast metabolism, they keep their weight really well. And people that have slow metabolism, they gain weight. Well, yeah, but if you have a slow metabolism, that kind of means that your cells aren't working as well. They're not as quick. They're not as fast. And someone with fast metabolism, their cells are on fire and they're working on all cylinders. So it makes our cells work. So if your thyroid's not working, all our cells are not going to be working. So you're just not going to feel good in so many different ways because all your cells aren't working. So mitochondria is what makes all energy production. And if you don't have thyroid, your mitochondria is not going to work very well either. So it's a big thing.
So that explains why somebody with a thyroid issue, Hashimoto's, might be having joint pain because of it's getting down to the cellular level that's affecting everything, including their joints. Very interesting. Okay, now you said that they're going to present with the symptoms of hypothyroid. Is there any symptoms separate from hypothyroid that would suggest also, okay, it's on top of hypothyroid, you have this Hashimoto's?
I mean, possibly. It all depends on what's causing the Hashimoto's. Let's say you have some gut issues. Well, you do get gut issues just from hypothyroidism, but let's say you could have an alternation between constipation, diarrhea, gas, bloating. That could be an indicator of having some gut issues. You could have some psychological stuff going on. You could be depressed or anxious. That could be related to your thyroid. Again, we said some sleep issues. That could be related to your thyroid too with Hashimoto's. You could have tons of other autoimmune conditions going on. I mean, I see people with 4 or 5 autoimmune conditions, and Hashimoto's is one of them. Or I diagnose Hashimoto's on top of all these other autoimmune conditions. Because when you have an autoimmune disease like Hashimoto's, your immune system's out of whack, and it's keeps on attacking certain proteins in your body. So it might interact with your thyroid, might interact with your gut, maybe you get colitis, maybe it interact with your joints, you get rheumatoid arthritis. If you just have Hashimoto's, don't think, oh, it's just going to be with my thyroid. It could really be a problem layered on. Or let's say you have rheumatoid arthritis, it could lead to potentially Hashimoto's.
Interesting. So if you have Hashimoto's, you have an autoimmune condition in which your immune system is attacking something that's not bad, right? It's designed to attack foreign invaders and in these types of things in the
Yeah.
body,
Mhm.
but now it's attacking something that's supposed to be good. And there's a reason for that. There's something happening in your body that's leading your body to want to attack your thyroid. And if it's attacking your thyroid, it's likely attacking other things. And now it's a matter of digging down to why is your body attacking your thyroid, and so we can look later on as to some of these possible causes for this thyroid. So you talk about symptoms with Hashimoto's. I know with any autoimmune condition, you might have different stages, like earlier stages in it, and then what might happen later on if it's not addressed. Can you talk a little bit about if someone has the beginning stages of Hashimoto's, what might be happening with their thyroid versus middle or late stage Hashimoto's?
So yeah, let's lump it up into three different stages. We could talk about the early stage. Very difficult to really know if you have hypothyroidism or not because it's going to be all over the place. So you might be tired one day, you might be anxious another day, you might be normal another day, and it's just all over the place. Because what happens is you might be producing too much thyroid for a little bit, you might be producing too little, you might be producing just the right amount, and it's just always varying and changing. So it's really hard to make a diagnosis by just ordering basic lab work because you might be normal. And if you just don't order Hashimoto's markers, you don't know what's going on. So that's that stage. It's all over the place. You really don't have a really know what's really going on, but you're just going to be all over. Your
So when
symptoms
you
are going to
when you say all over the place, that would to me that would suggest that you'd have to have a number of labs over a course of time to be able to even see that your thyroid's up, your thyroid's down, that kind of a thing. So
so
is it helpful then anybody who's health conscious wanting to make sure that their thyroid's staying healthy to check their thyroid multiple times a year so that they can see possible patterns like this?
So let's say you are experiencing like you're tired, but then sometimes you're feeling really anxious. You may be anxious and tired, or you might be constipated. You're having difficulty losing weight, but you'll go to the doctor and everything looks normal. First of all, what I would do is make sure you always order Hashimoto's thyroiditis panel, like antithyroid peroxidase and thyroglobulin antibodies, just to make sure you do have Hashimoto's. Because if you just order the TSH or let's say a free T4 or free T3, those numbers might be low one time. They might give you thyroid hormone, but guess what? Now you're going to go hyper. Oh, wait, now you're going to be way hyper because you're on thyroid hormone. So it's really important to really identify if you do have Hashimoto's or not, because again, at the beginning stages, it's all over the place.
It's going to be up and down. Interesting. Okay. Middle stages. Now, as far as time goes, is there like a standard amount of time? Like typically early stages takes 1 to 2 years, or is everyone different?
There's no standard there. It just depends how severe your immune system's doing, how much attack is happening to your thyroid, or if you're actually doing something for your Hashimoto's or not. So there's not a specific time frame at all. So you could go from first stage to second stage within a couple months, or it could take several years. So
Okay.
no,
So
no,
middle stage, what might they be seeing in their labs?
yeah, middle stage, they're going to be more, they're going to not have the hyper symptoms. They're going to feel kind of normal, or they're going to feel really fatigued and have all the other hypothyroid symptoms that go along with that. And then if we go to the later stage and you haven't really done anything for the Hashimoto's, you're just going to be hyper all the time. And if you wait too long, you're going to always have to depend on thyroid medication because there's too much trauma to your thyroid and it's just not working anymore. So the earlier you treat it, the better. If you do it in the early stage, you're not going to have to depend on thyroid hormone. We treat the autoimmune condition. You're not going to have thyroid hormone at all. If you're in the middle stage, many times we could get things under control. And many times prescribe some thyroid medication to get you feeling better. We work on the autoimmune component of Hashimoto's, take that away, and many times you're able to get off their thyroid. But if you wait too long, we're going to have to keep you on thyroid. I still want to treat the Hashimoto's, get that under control to help you feel good, but we're probably going to still have to keep you on thyroid medication.
So what I'm hearing is that there is a point of no return when it comes to like how if the immune system has attacked the thyroid for an extended amount of time, now you're into like the final stages. There comes a point where your thyroid is just not able to recover. So you can
Yep.
treat, okay, you can treat why your body is attacking the thyroid, but at this point the thyroid's been attacked, it's not working functionally. So now we continue on the medication to at least deal with those symptoms while addressing the causes.
Yeah, and we
So,
want to do it too because it can lead to all kinds of other autoimmune conditions. So you think, oh, well, I just have Hashimoto's, who cares? I'm fine. I got my thyroid medication. We're doing good. guess what? It could lead to Addison's disease. It could lead to Crohn's disease, ulcerative colitis. It could lead to rheumatoid arthritis. Who knows? All kinds of different autoimmune conditions. And I see this all the time. So you definitely do want to deal with Hashimoto's and just don't let it hang out doing nothing.
Okay, so then let's be clear. So let's say there's somebody right now who's listening who knows they have hypothyroid. Their doctor's already diagnosed them with that. But now they want to go, okay, wait a second. What if I'm one of the 80% and I actually have Hashimoto's as well? What are some of the labs that they might want to request to first figure out if they even have hypothyroid, but two, to rule out whether or not Hashimoto's is a part of their issue?
First, you want to rule out to see if you have Hashimoto's. So you want to order antithyroid peroxidase antibodies and thyroglobulin antibodies. So that's to rule out if you have Hashimoto's. Any doctor can order that. Just ask your doctor for those specific labs and they could get that going. Or you could go to a doctor that really understands how to treat Hashimoto's and they'll get that going for you. But also you want to order the other labs, TSH, free T3, free T4, reverse T3 to really know how to treat it appropriately.
T3, T4, reverse
Free
T3.
Free T3.
Three
Don't leave out
T3.
that free. Yeah.
Okay.
Because there's total T4 and total T3, which they're all bound to proteins. It doesn't give me as good of a look. I like to see the free, which actually is available to your cells. So not to mess with you, but I just want to make sure that that's the freeze in
You're
there.
not messing with me, doctor. You're the doctor. I'm glad. And that's why I want to just repeat these, because I know, for a lot of us who, don't have the education that you have, like, we're writing this down and we want to get it right. We want to be able to go to our doctors and say, okay, please get these labs done. So, okay, they see a doctor, they get these labs done. Some flags go up. How is a traditional doctor going to treat them versus an integrative approach?
So let's say you go to your conventional doc. Maybe he's already been treating you for hypothyroidism and you're like, hey, I want to see if I have Hashimoto's. Your traditional doc might look at it and be like, okay, yeah, you have Hashimoto's. I'm not going to do anything about it. I'm going to keep you on your thyroid hormone. They don't do anything about the autoimmune condition for Hashimoto's thyroiditis. They just let it hang out and you just treat the thyroid condition and that's it. So what I do is I'm going to treat you completely different. If you just have a functional hypothyroidism issue, I'm just going to treat it that way, maybe put you on thyroid medication, give you some herbs, nutrients to help support your thyroid, give you some iodine, things like that. But if you have Hashimoto's thyroiditis, I'm going to treat you like you are an autoimmune patient now. I'm going to find out what is making your immune system attack the thyroid. What's the reason behind that? So I'm going to look at your gut health. I'm going to see if you have any food sensitivities. I'm going to see if you have a gluten issue at all. I'm going to heal up leaky gut syndrome. I'm going to see if you have any bad bugs hanging out in your gut, or you have candida in your gut, or other funguses, or maybe other parasites hanging out in your gut. So that's just the gut piece. Or maybe you don't have enough good bacteria. So that's a big piece there. Then we see if you have chronic infections throughout your body. Let's say you have a chronic viral infection, like Epstein-Barr virus instead of megalovirus. Maybe you have a protozoa like Lyme disease, or let's say you have mold exposure and you have high mycotoxins, and that's causing your autoimmune condition. Now we look at other toxins like, let's say, heavy metals, or let's say pesticides or herbicides. We look to see if you have any detoxification issues, if you're not detoxing well through your gut or your liver or your kidneys. Many times with hypothyroidism, you're not detoxing very well because you're constipated, so you're not going to be eliminating very well. So we're going to work on that and fixing that up. So that's just a quick rundown. There's all kinds of other things going on with autoimmune disease that we need to dive into, but that's a quick rundown of kind of what my mindset is. And when I'm going after someone with Hashimoto's, is I'm going to find out what is causing that autoimmune condition and take that away so the immune system stops attacking the thyroid and we're able to save it. Or if, at the very least, if we're not able to save your thyroid, we're able to keep your immune system from attacking other tissues throughout your body.
Out of all the things that you had brought up, I mean, you're bringing up a ton of possible causes. Are there a couple that are like ones that you most commonly see as a cause for the immune system attacking? Like, as far as, yeah, just common causes for it that seem to be across the board.
Very common is gluten. There's a strong correlation between Hashimoto's and celiac disease. Now, celiac disease is just a piece of gluten issues. I mean, there's all kinds of gluten sensitivities and other immunological reactions that can happen from gluten. So just because you don't have celiac disease doesn't necessarily mean you should be eating gluten with Hashimoto's. I almost always take my patients that have been diagnosed with Hashimoto's off of gluten. Also, dairy is a very common one too, but gluten is the top there. And I always see people with Hashimoto's have some type of gut issue going on. We just need to identify what type of gut issue it is. And it's very common. Almost all of them have leaky gut or increased intestinal permeability, and we need to fix that up. So those are some of the ones I always see as an issue.
Okay, now let's dig even a little further. I'm going to kind of geek out with you, Dr. Jake, but I'm hearing a couple of things. Okay, if gluten tends to be commonly an issue, if leaky gut and just like this gut permeability issue tends to be a common problem, why? Why is this a problem? What's causing the gluten issues and the gut permeability issues in our society that's leading to it setting off Hashimoto's?
So I'm not necessarily anti-wheat or anti-gluten. I think it was great for people for a really long time. It's been used for thousands of years. But what's happened is we've modified our wheat in recent years. We changed it in the 90s, and we also started spraying it with tons of glyphosate, which is Roundup. So I think spraying it with tons of Roundup glyphosate is causing damage to our gut lining, increasing these things called zonulin, which then is widening our intestinal cells, the enterocytes, which is then allowing certain food particles that aren't supposed to get in the bloodstream, make our immune system irritable, wakes it up, and then it starts interfering and there's something called molecular mimicry, and starts seeing a certain substance that looks very similar, that's a foreign substance that looks similar to a natural substance in our body, and now it starts attacking it, like the thyroid. So the gluten molecule looks a lot like the thyroid molecule, and then they start attacking the thyroid and also attack the thyroid and the gluten. That's what is happening there. And then you could have your immune system just going all kinds of crazy because you're eating all the time and you're leaky, and all these substances are getting in your body that aren't supposed to be there. Also, your immune system's mainly hanging out in your gut, and that's inflamed and damaged. And it's just making you totally chronically inflamed, which most chronic diseases related to that. So yeah, I hope I answered that question well enough.
Yeah. And I know that we go into much more depth on another episode where Dr. Jake really talks about autoimmune conditions and how to address them, what the causes are, and so forth. So make sure and check that link in the description box. We're also going to have it at the end of this video so you can dig further into autoimmune and what's happening there with the body. Going back to Hashimoto's, okay? Somebody has maybe hypothyroid. They haven't addressed whether or not it's caused by Hashimoto's. I've got my T4, I've got my T3, I feel fine. My doctor doesn't say that it matters whether or not I find out why he's going to treat me the same. What warning might you give people in not figuring out whether or not Hashimoto's is the issue? If they have Hashimoto's and it's undiagnosed, what potential issues might happen?
So first off, the potential issue is your thyroid's going to continue getting attacked. And let's say someday you're like, hey, I want to get off my thyroid and not have to depend on my thyroid ever again. And maybe I want to go to a doctor and just maybe take some herbs and things and nutrients to see if that helps with my thyroid. If you wait too long, none of that's going to work. You're going to absolutely have to be on thyroid your entire life. But also, Hashimoto's is just a first warning sign. Many times it's one of the first diagnoses of autoimmune disease you get. And then there's all kinds of things that could start showing up. Let's say you start getting Addison's disease. Now, Addison's disease is an attack of your adrenal glands. And if that happens, then you don't have any more cortisol produced. Cortisol is what gives us energy, focus, concentration, blood sugar regulation, waking up, keeping our blood pressure up, all these type of things. So if you start getting that, you're not going to enjoy that at all. And then now you have to depend upon cortisol all the time or prednisone all the time to be able to function. And then you get the side effects that go along with the prednisone. Let's say then maybe it starts to attack your colon, and then you get a colitis, or let's say like ulcerative colitis or Crohn's disease or something like that. That's going to make your gut even more leaky. That's going to lead to other issues too, but then you're going to lead to all the symptoms that are related to that. Diarrhea, abdominal pain, etc. It could also lead to rheumatoid arthritis or maybe even something more severe, multiple sclerosis. So you want to it's just a little baby. I think Hashimoto's is kind of this really nice beginning stage. Okay, you have autoimmunity, and we need to chill that out, because if you don't, you're going to have all kinds of autoimmune diseases going on if you don't treat the causes of that autoimmunity.
Wow. So would it be safe to say then that if somebody listening to this does know that they have lupus or multiple sclerosis and some of these more advanced autoimmune conditions, then would it be safe to assume that they probably have Hashimoto's as well, or a thyroid issue as well, as one of the many things that they need to be addressing?
It's a definite possibility. I see it a lot in that population group. It's not going to absolutely be there, but it's likely.
Okay. I'm going to ask one more question that we were not prepared for, but I want to ask you, especially since we're dealing with autoimmune and Hashimoto's and so forth. Probiotics, vaccines. If you already have an autoimmune condition like Hashimoto's and your immune system is on drive, as far as like the typical vaccine schedule and things like that, with a lot of the diseases that are out there, do vaccines make autoimmune conditions worse? Like, can it turn on more or make it more advanced or not? Is that something that somebody should be wary of if they have Hashimoto's?
So vaccinations are prescribed a lot for patients that have autoimmune disease, not necessarily Hashimoto's because they don't do anything for that, but for other autoimmune conditions because they're giving you immunosuppressive medications and then they say, hey, we're going to give you vaccinations because we don't want you to get all these potential bugs and you're going to be worse with the flu
Mm-hmm.
or other pneumonias or things like that. So we want to put you on these vaccinations. Interesting thing about it though is your immune system's suppressed. So who knows if you're actually going to make the antibodies to that vaccine. We haven't really looked at that in detail. Be like, okay, this autoimmune group, we're giving you vaccinations. Are you producing enough antibodies to actually be immune to this flu or whatever? So that's a question I have. Also, what can happen with a potential vaccination if you give it is you can exacerbate their immunological reaction because that's stimulating the immune system, getting the immune system stimulated, and that can maybe exacerbate it. Just like a potential virus can maybe exacerbate people's autoimmune conditions, so could a vaccination. And let's say you're getting a flu shot and then it has some mercury in it, which the flu shot does have mercury in it, and then you have a reaction to that mercury, that could be an issue too. So not saying I'm absolutely anti-vaccine for autoimmune patients, but I am hesitant in people that have autoimmune disease, depending on the case and the individual, because it might exacerbate their symptoms.
Thank you for that. And then the last one that I had mentioned, and I think I misspoke. I think I said probiotics, but I meant antibiotics. You were talking about gut health as being like a part of Hashimoto's, typically like you want to address gut health. And I know that we live in a world where it's just like antibiotics seem to be just like the common treatment for so many things. What is your take on that, on somebody with Hashimoto's taking antibiotic for various conditions?
So taking a lot of antibiotics could have been potentially one of the causes of Hashimoto's because you wiped out a lot of your good bugs. The good bugs are these, they help heal up our gut, help us digest our food, decreases inflammation in our gut. So if you don't have those good guys hanging out in there very much anymore, it makes residence for other bad guys to get in there, but also you're going to be more prone to potentially getting trauma or food sensitivities that can come along because you trashed all those good bacteria in there. So antibiotics could potentially be the cause. Also, let's say you have Hashimoto's autoimmune condition and you're taking a lot of antibiotics and you further damage your gut, that's going to make it even worse too. So antibiotics could potentially be a cause and it could potentially make the symptoms of the autoimmune condition worse because of the trauma it does to our gut.
Well, all the more reason I think why I think it's important for somebody who's struggling with hypothyroid, possible Hashimoto's, to come and see an integrative doctor like yourself so that they can really take a look at all it seems like it's a very complex, like, and everybody's story might be a little bit different in what caused it and how to treat it and so forth. So if someone wants to dig further into this and they'd like to talk to you about their health journey, how might they get a hold of you?
So yeah, visit our website, integrativemedica.com. Visit our phone number, 801-676-9976. Find our number on there. Give us a call, set up a visit with me or someone else on my staff. We could set up an in-person visit or a virtual visit, and we could talk about all these things in the visit.
Perfect. Thank you so much, Dr. Jake. And everyone else, again, the next video, we're going to be talking about autoimmune conditions a little bit more in depth. So check that out if you want to go and geek out on autoimmune. Until then, we'll talk to you guys later. Have a good one.
Hey, Dr. Jake, thank you for your time today. And if you enjoyed the show, then do us a favor and leave a review. It helps more people to find the show, which could save their life. And remember, this is a podcast and should not replace personalized attention from a medical professional like Dr. Jake. If you or someone you know has been diagnosed with an autoimmune disorder, cancer of any stage, or a life-changing illness, visit our website today and schedule a virtual appointment with one of our doctors who can lead you to a treatment plan in your area. That's integrativemedica.com. Integrative, hypothyroidism.com.
Thank you for listening to the Integrative Medica podcast with Dr. Jake. To hear past episodes and get alerts for the future, subscribe to us on your favorite podcasting platform and be sure to follow us on YouTube as well. Just search for Integrative Medica with Dr. Jake.